It's also known as the bleeding eye virus.
The CDC issuing a warning to U.S. public health officials about an Ebola-like virus known as Marburg.
Here is a hot health headline for you. This one is very, very serious, so pay attention. Right now, health officials are warning about an outbreak of the Marburg virus. All right, this is a very serious one. It's also known as the bleeding eye virus. It's coming out of Rwanda. That's in, I think, East Africa. And it sparked concerns about a potential spread outside the country. And that's the biggest problem.
And this one is proving to be deadlier. It's called the Marburg virus. It causes hemorrhagic fever, and the fatality rate is very high. The virus belongs to the Ebola family, which is why countries are worried and have begun issuing advisories.
Even though it's over there in Rwanda, that's where they got the cases. They don't know who traveled in or out and contracted the virus and who spread it outside of that country. So the U.S. State Department issued a travel advisory just last month, November 22nd, recommending that travelers exercise increased caution in Rwanda due to the outbreak and in other countries. So travelers may be subject to additional health screenings when entering or exiting Rwanda. So if you know somebody that's entering or exiting Rwanda, please use caution or let your people in Rwanda know. If you're watching this from Rwanda, then please spread the word. Try to be safe as you can. But yeah, also you guys need to know that this is kind of similar to the Ebola virus. And Marburg is a rare but severe viral hemorrhagic fever, meaning you bleed. You bleed a lot, all right? And it's highly deadly. According to the CDC, it has a 20% to 90% fatality rate. That is huge. A 20% to 90% fatality rate. All right? This is a serious disease that you guys need to be aware of. All right? We can't play any games with it.
A virus that kills half the people it infects and brings about a fever that leads to internal bleeding. Patients bleed in several parts of their body, and it's often the blood loss that takes their lives. The symptoms are unbearable.
The first case that they had was confirmed in September, it was in September, and as of November 29th, the county had 68 cases. 68 cases of the virus, and they had 15 deaths. So, and that's just of, 2 weeks ago. I'm making this around the 15th, 16th of December. So November 29th, they had 66 cases and 15 deaths already. So most of the affected people have been healthcare workers trying to treat people that have it, but that's how contagious this can be. My words are just, I'm getting too excited, man. I'm really passionate about this, though. You know, this really isn't a joking matter. I'm not laughing at anybody who has the disease or contracted it. I'm laughing at myself for being so flustered trying to get this information out. But that's one thing you guys will see on this channel. When I start speaking about things that I'm passionate about, you know, my emotions get involved, and I just, you know, sometimes my brain always moves faster than my mouth and my body, always. So keep that in mind. Let me see, 75% of the patients with the Marburg virus have recovered, according to the CDC. There haven't been any confirmed cases in the United States yet. Yet. But the CDC says the risk of infection in America is potentially low. But at the same time, how can you really count on that? You don't want to be the 1 or 2 or 5 or 10 cases where, oh, the potential is low out of 300 something million, but a few of you have it and you're bleeding out of your eyes. Not good. So don't take any chances. Marburg is one of the deadliest viruses that infects humans. Dr. Siegel, he's a senior medical analyst for Fox News and a clinical professor for medicine at the NYU Langone Medical Center. So he's letting you know, Dr. Mark Siegel, he is one of the leading senior medical analysts, and he says it's one of the deadliest viruses that infects human beings. It's in the top 3, top 5. I think it's the top 3. It might be top 2 and it's not 2. I'm not sure. But it's very similar to Ebola in that it causes hemorrhagic fever, bleeding, profuse bleeding from the orifices from everywhere. And I think mainly from your eyes, probably because of the pressure. It just pushes the blood out your eyes, and it's very nasty, very bad. The initial symptoms usually mimic the flu, including the fever, body aches, diarrhea, abdominal pain, and vomiting. You know, it kind of mimics listeria. So you might think you have listeria, but it can morph into this, or it wouldn't morph. You could think you have listeria, but then it can get much, much worse if you have Marburg. So pay attention. There's an interval between infection and symptoms. It's usually between 2 days and 21 days that they are advising. They're saying that if you contract this virus, the Marburg virus, within 2 to 3 weeks, 2 days to 3 weeks, 21 days, you can develop the symptoms and you can start feeling it. And that's a wide range. That is a wide range, man. Because then it's hard to backtrack where you might have caught it from, who you were in contact with, were you at the store, were you at the supermarket, were you out somewhere? Man, that's not good. In severe cases, patients may experience extreme weight loss, jaundice, inflammation of the pancreas, delirium. You know, you may not know where you are. You can have shock, liver failure, massive hemorrhaging, and multi-organ shutdowns. This is straight from the CDC. So you need to be aware of this. It can also cause, of course, bleeding from the eyes, but also bleeding from your nose. You can have bleeding from your mouth, bleeding from your gastrointestinal tract, meaning like when you're taking a bowel movement, you're going to the bathroom, you can have, you know, bleeding from that. You can have, you know, it can come back up, so it just might come out your throat. You know, the nickname is, you know, the bleeding eye virus because pretty much everything can just bleed internally and externally. It just, your eyes, your mouth, your nose, you just be pushing blood out of every orifice. And that's not a good sight.
High fever, muscle pain, bleeding, severe headaches, diarrhea, and vomiting blood. This could mean you have contracted the Marburg virus. The virus belongs to the Ebola family, and it has the world on edge.
The virus is transmitted via bodily surfaces. This is a big thing. Pay attention. The virus is transmitted through bodily surfaces, like, contact with other people, blood, and you can also get it from contact from contaminated surfaces. So this is straight from Mark Siegel, where he's the leading analysis of this disease over at in NYU. And yeah, just any surface. You touch the steering wheel that somebody else touched, you touch the counter that somebody else touched, and that's enough for you to have, the Marburg virus, the AKA, bleeding eye virus. So, yeah, this is not good, but it seems like the natural host for the virus is the Egyptian russet bat. That's what the CDC is claiming, but I don't know how many people are coming in contact with that. But once you come in contact with a person that's infected, that's probably your biggest concern. Unless you're out here bat hunting at night. If you're out here trying to catch bats in your free time, stop it. Don't do it no more. You need to cut it out. Leave it alone. Catch, I don't know, catch butterflies, catch lightning bugs in a jar like we used to when I was kids, or when we were kids. But yeah, right now there are no adequate drugs or vaccines for Marburg. So unfortunately, there's no treatment for this disease. As nasty as it is, there is no treatment right now. I'm sorry, there are no adequate drugs or vaccines for the Marburg virus. Medical providers, they can manage your symptoms and with supportive care, including oxygen. They can give you oxygen, pain medications, IV fluids, and they can rehydrate you, give you the IV drip and give you your, what do they call that in the bag? I know it's the fluids, but I can't think. But you know what I'm saying. They'll rehydrate you, but there really isn't much they can do for you, man. That is not good at all, at all. Right now, they're working on some other treatments, they have said. They're in the works, including experimental vaccines that are coming up. And you guys know how I feel about the experimental jabby jabs. Not a big fan of those. But you catch something called the Marburg bleeding eye virus, you just might be willing to experiment with a few things. If you actually get the disease, then death usually occurs within 8 to 9 days after the symptom onset. Typically due to blood loss. And that's kind of sad because they said it can take 2 to 21 days for the symptoms to come about. But then after you get the symptoms, usually 8 to 9 days, a little over a week, most patients pass away. That's not good. That is not good. Yeah. So far, there's no risk of intercontinental spread, they're saying, per se, but that's very contradictory. They don't know who inside Rwanda has it, all the cases. They don't know who left, who traveled. A lot of the medical people have it, the nurses and the staff, and then they got to travel back home or come back to the States or go to another one, the UK, Australia, I don't know, China. I know India, they got a lot of doctors. So there's a few recommendations that the CDC has for not contracting the virus. Number one, you want to avoid contact with the blood and bodily fluids of people who are experiencing symptoms. 2, do not touch items that may have come in contact with the bodily fluids of an infected person. 3, avoid contact with Egyptian russet bats and non-human primates in areas where Marburg cases have been reported. So I know it's going to be hard for a lot of people to stop chasing bats and just chasing animals that like to eat bats or whatever. All I'm saying, a lot of raccoons out here, they climbing the trash, you know, where we're at in the Midwest and all this, and you just never know, man. You just never know. Probably a dog or a cat, you know, they're going to attack a bat in a minute. So, yeah, not to really scare you or anything, like I say, it's not widespread like that, but you just never know, man. Everything, when you look at it in history, every disease has a starting point, has a patient, what they call it, patient zero, where it starts. And, you know, we just hope that this isn't something that spreads, because it's just like Ebola. I think Ebola is number one, and then the Marburg is two, from what they're saying. But yeah, this is something that's serious. And yeah, I want you guys to pay attention to all these different health headlines that I give you guys, because you may be listening in a faraway place. You may be in Africa listening to this and it applies to you, or you may be somewhere else and it doesn't apply to you, but you might know somebody, or, you know, information can save the nation. So just having information. Thank you for staying this long and listening. I appreciate it. And yeah, I'll catch you guys on the next one. Stay safe, stay smart, and stay informed. All right. See you later. Bye.